Hello, I'm Joan Justice from HealthWorks Collective, and I'm here with Lou Caputo, CEO of Summerville Medical Center in South Carolina. Summerville just adopted a novel hand hygiene system that can help reduce the risk of hospital infection by tracking hand washing behavior. Of course, by reducing infection risk, hospitals can raise the quality of patient care and reduce complications, longer hospital stays, and increase cost. Lou, tell us a little bit about the hand hygiene system in place at Summerville, how it started, and how it works exactly.
Sure, and thank you for having me.
Uh-huh.
Summerville Medical Center is part of HCA, and HCA has a long-standing relationship with GE Healthcare. For years, we've been using GE's technology and software call it Agility or Agile Track. Really to track assets and inventory management, and also bed placement and patient management throughout the facility. And in dialogue with GE, we began to ask each other, how else can we leverage this technology? Where is there a place in healthcare to use this on a broader level? And at the time, a few years ago, with healthcare reform, there was the increased attention to hospital-acquired conditions, hospital-associated infections. And so the discussion began, can we use this technology to improve our hand hygiene compliance and thus reducing the hospital-acquired infections, knowing that there was plenty of studies out there that associated hand hygiene compliance, simple hand washing with infections. And so we began working with GE to develop that technology. So where we've landed, we've gone live within the last 6 months, is using RFID technology and real-time locating system technology to monitor caregivers when they interact with the patient, whether they've washed their hands or not. So we each caregiver within the hospital receives an RFID badge that goes along with their hospital ID. Mm-hmm. And when they enter and leave a room, there is a signpost in each room that detects that. And what that signpost is looking for is a hand hygiene event. So when an individual engages a gel dispenser or a soap dispenser, the technology says, Lou Caputo has entered room 203 and has washed his hands with gel or soap. So it would say that I am compliant. Mm-hmm. But what it also does is if I don't do it, it says that I'm non-compliant. All that data goes into a database, and we have very sophisticated dashboards that we have worked with GE to build that allows us to track it. And we share that data with staff to really drive compliance and hold each other accountable and really see what we can do better.
Mm-hmm. Great. How does the staff, how do the healthcare professionals feel about being monitored?
Yeah, that's a great question. Certainly there was some anxiety at the beginning, really with that big brother syndrome. It was can you watch all of the things that I'm doing? But through conversation and transparency and really working with them to develop the technology, we were able to address those concerns. It's been fully embraced by the staff, primarily because we've shown them what the capabilities are and what it can't do. So we can't or we won't detect them when they've left their shift and walked out to their car. But what's really important for us is when they're engaging with patients, are they washing their hands? And we show them that data.
And so you're open about it. You're completely open with the data. Yeah.
Yeah. And it certainly brings up some great discussion with the staff as well and their workflows and how one caregiver is different from the other. There's also that peer that peer element to it. Sure. And that competition. They don't want to be the lowest person on their unit or in the hospital. Uh-huh. So we play that to its fullest as well. But we also recognize and reward the people that do a great job and thank them for taking it seriously for the patients and for themselves, because caregivers can get sick too from the things that their patients can transmit, and we don't want them getting sick and missing work, and we don't want them taking it home to their kids and to their spouses and passing it along to them too. So they they understand the importance of hand hygiene. They understand that the benefits there are to the patients and to themselves, and so they've really embraced it.
Mm-hmm. Great. Now, what does the data look like? Has your incidence of hand washing increased? I bet it has.
It definitely has. That's really the benefit of the technology, is the data and the granularity of the data that you can get from it. People in hospitals have always washed their hands. The expectation has always been that you do a good job washing your hands. But the data allows you to get so much more information out of it now than the old secret shopper method, by having somebody stand in the hallway and check off a piece of paper when a nurse walks into a room and washes their hand. At Summerville, we were getting about 80 data points a month through observation. Now we get about 8,000 data points a day, which is a lot of hand washing going on.
It sure is.
And it's been great because it does give us sophistication in engaging with the staff, but it also allows you to really track how well you're doing now compared to the past. Now we don't have good numbers from a hospital wide because we've sort of rolled this out in phases, but each phase we roll it out, we see about a 25% increase or improvement in the compliance.
That's great. And what do patients think about this?
I think they think it's great. I mean, we've received great feedback from them. Patients always want to make sure that they're getting the best care possible.
Of course.
And a lot of times it's hard to detect from a patient what that means to them. And hospitals get a lot of that information on the back end from the HCAHPS surveys. But it's really hard to get some real-time information on a larger scale. But what's been nice about this is when a staff member enters a room and they do wash their hands, there's a beep that goes off as well, and it's a nice little reminder that they've done what they are supposed to do. I call it a thank you beep that says thanks for washing your hands. Well, go into a patient's room 4 or 5 times and they hear that beep. They've started asking our caregivers, why every time somebody enters the room is there a beep? And we share with them that it's what the technology is and why we're doing it. And that it's really to make sure that the patients are kept free of infections and that they don't get a hospital-associated infection. And they appreciate that because to them that's great care. It gives them a sense that we're doing good things to make sure that their rooms are always kept clean and that they're free of infection. So they appreciate it.
Yeah, that's great. Thank you so much for letting our readers know about this sophisticated system. And anything that helps lower the risk of infection is so important for patient care. Thanks so much, Lou.
It's my pleasure. Thank you.